You're listening to the Ranch Stewards Podcast, a podcast dedicated to the stewardship and conservation of grasslands, diverse ecological landscapes, and the salt of the earth individuals who dedicate their lives to this endeavor. And now here's your host, Haylie Shipp.
Welcome to the Ranch Stewards Podcast. I am Haylie Shipp. This podcast episode is called Insuring the Rancher, Preventative Care That Pays Off. In 2024, my family was hit with a major health crisis. It stopped us in our tracks, and it changed the way I look at everything. Because no matter how much we plan for markets, droughts, or succession, none of it matters if the people running the ranch go down. Preventative health care is ranch insurance. It's how we keep the operation moving, by making sure the people behind it are healthy enough to keep going. Joining me today is Dr. Kevin Ross. He is with Francis Mahon Deaconess Hospital in Glasgow, a critical access hospital serving northeast Montana, along with rancher and registered nurse Carmen Salveson. Now, we're going to be talking about rural medicine, prevention, and why the smartest thing you can do for your ranch might just be taking care of yourself.
Montana. We are proud to say it's where we live and where we work. The vibe is different here. We are friendly, caring, hardworking, resilient, and resourceful. No one else covers Montana or cares for Montana more than Stockman Bank. To us, Montana isn't just a place. It's the only place we do business. That's why we are Montana's brand of banking.
My name is Kevin Ross. I'm a family practice doctor. I've been practicing in Glasgow, Montana for roughly 13 years. I grew up in a rural community in southeastern Washington and attended Washington State University for my undergrad and master's, both in animal science, and thought I wanted to be a veterinarian, but paths led me different directions, and so I went to medical school in 2005, and I kind of picked my residency before I did my medical studies. I wanted to practice rural medicine, critical access medicine, and so I completed my medical training and then attended a residency in Casper, Wyoming, focusing on underserved rural areas in the United States. And we do full spectrum family practice here. I deliver babies all the way to 101 years of age. We take care of everything in this small town.
Dr. Ross, I sort of tapped on it a touch, but can you better define that critical care hospital and what that term means?
You bet. So under the federal government, there are critical access hospitals, which are usually 25 beds or less, inpatient, and then we have a rural health clinic as well. We focus on preventative health care as well as treating active diseases, and there is federal funding to keep these smaller hospitals open, but as we see the changes in medicine, we see a lot of these smaller hospitals are limiting care. We're lucky enough to in Glasgow, Montana, to have multiple specialties and things like that. But it's usually more of a primary care role, family practice, internal medicine, pediatrics in these rural health clinics and critical access hospitals.
And I never know if I'm getting the population right. I always say Glasgow's between 2,500 and 2,700 people, something along those lines. And then Carmen, of course, where you're at in Malta, that's even a smaller population of folks that are there receiving health care at your hospital in Malta. Isn't a critical care facility, is it?
Honestly, I don't completely know the status here, but it's a smaller hospital than Glasgow by quite a bit. We do have a family health clinic and a hospital with beds and an emergency room, but we don't have as many specialties or surgeries as Glasgow has.
I'm putting Carmen on the spot here. She doesn't even work at this hospital.
I know. I'm sorry. I do live here, but I don't work here.
So Carmen Salveson is with us. She is our rancher nurse, goat raiser extraordinaire on the podcast. So Carmen, folks that have interacted with RSA, of course, have heard from you before and talking about your adventures being in the goat business. But of course, you also wear this RN hat, which is something that you do with teaching, as well as something that I know you have to wear in a family ranch operation because you're sort of the resident healthcare specialist for the family, I'm sure, when anybody has a bump, bruise, or needs to go in for something and you have to urge them along. So why don't you give us a little bit of your background?
Yeah. So my name's Carmen Salveson. I grew up here in Malta. After graduating, moved to Havre and got my BSN in nursing through MSU Northern out of Havre. Decided I wanted to keep going on in school and eventually get to teach nursing. So I got my master's of nursing through the University of Phoenix. And since then, for about the last 10 years, I've helped teach remotely online through MSU Northern's RN to BSN program. So I've gotten to do that not full time, but part time, as I've had 4 kids in that time frame too. So I've gotten to stay at home with them, live on the ranch, help my husband. And this year I've started a new adventure. And in January, started teaching a class for Ani Nakota College out of Fort Belknap, their Grow Our Own RN program. So I'm teaching a class 1 day a week there in person, which has been really great. So
as we get into this discussion, for folks that listen to the Ranch Stewards podcast, a lot of times we're talking about soil health or, virtual cattle collars. This whole healthcare discussion and the fact that we've had it in back-to-back months is a little bit different. And so I guess I'll just do full disclosure here in that my dad was recently diagnosed as recently as last fall with stage 4 colon cancer. And the type of individual who I think is a lot like a lot of our listeners in that he never went in for preventative care. He never went in for his Medicare physical. He never had a colonoscopy until we found out we were stage 4 cancer. And so I think knowing the general population and around this region, and I have had a lot of, fairly intimate conversations with a lot of folks around this topic, there just tends to be a hesitance for some reason. You don't go into the doctor unless something is really majorly wrong. The last time I remember my dad going in was he had a broken ankle with, his bone was very clearly not where it's supposed to be. So, you just don't normally get these folks to come in casually as often as we may see folks in a different demographic. Not to say that some of them don't, but I think that there's maybe a little bit more reluctance. And so the argument that I want to do in this discussion today, and during the last podcast, I did kind of want to correct it. I said that, when you get diagnosed with something like a stage 4 cancer, that it's almost like somebody died in the operation, to the effect of they are suddenly completely out of the workload. Somebody else is having to now pick up all of the pieces, but then they're also now having to do the medical care and all of that navigation for them as well. And I just want to correct that in that I by no means mean that a death is similar to a diagnosis, because that is completely separate. I really just meant on the workload component, because we do so much estate planning and we do so much succession planning so that we can make sure that when it's our time, that this ranch is going to be handed on to the next generation exactly how we want it to be. But we somehow omit this thought that if we're not taking care of ourselves, this ranch could have detrimental responses to that, to the fact that we could now be needing advanced care, huge doctor bills, time away from the ranch, not only for me, but for my caretakers that are going along with us. These can be major, major setbacks to the operations of a ranch that aren't a death, but they are something that's comparable, I think. And so the persuasive argument that I'm trying to do today is that this isn't a chore. What preventative care really is an insurance. It's just one more insurance for a ranch that you can keep it sustainable, that you can keep that viability going and limit surprises that you have on the operation. We're just going to talk kind of in some blanket terms. And so and maybe we need to, you guys are the medical professionals, I'm not, maybe we need to refine it into an age group of tests perhaps. But I guess, Dr. Ross, if you are going to approach this to somebody that has never gone in for preventative care, they don't do annual physicals, they just are somebody that only goes in if they really have an issue, how do you push them to start going in? What are some of maybe the initial tests, the initial screenings that you recommend to the public?
The way that I explain this to patients and to family members who are a little bit ranchy as well, is it's better to prevent a fire than put out a fire. And preventative medicine keeps us from going down those paths. You mentioned your father with stage 4 cancer. Some of those early screening things that usually start between ages 45 and 50, for example, colonoscopies or other colon cancer screenings, prostate cancer screenings, mammograms, osteoporosis screenings, annual labs, and just make sure that there's no leukemias, lymphomas, or other abnormalities with the organs. There's so many different things that we can do as physicians and as nurses to help prevent these illnesses, but a lot of it comes from relating with your patients and kind of building on those common beliefs. One of the things that I see with ranchers is they take really good care of their animals, and they kind of focus more on the ranch and less on their own health. We primarily see a lot of the ranch families bring their kids in for wellness exams, and then as the kids grow older, they become more busy in school and sports and on the ranch, and then that kind of peters off. But those are the ages that really teenagers and young adults should be seen to screen for some of these other problems. The one thing that I see in healthcare in Montana is the access to insurance and things like that. So that's a big deterrent as well. But one thing I talk to my patients about is that there's a lot of grant programs that will help and assist in these cancer screenings. There's a whole office at the university at MSU looking at preventative care and grants. The Montana Health Care Foundation can help support some of this. They have initiatives on solutions to these medical access problems. There's insurance companies that will waive screening fees for labs and for other imaging as well.
And Dr. Ross, I know you're not an oncologist, but I don't think this is too in depth of a cancer question. And that I think that there is maybe a generational difference or a generational deviance to how people perceive the word cancer. In that, in the 1970s, it was immediate death sentence. And then, now we've scaled to where there's so many different treatments and so many possibilities and so much more early detection now. But for a lot of these folks, they're maybe still in that mindset from 50 years ago where they hear that C word and it's almost like they don't even want to go in to find out that they could have it because they don't want to know about it if they do, not realizing that if they find out about it early enough, it's not necessarily that major of a thing.
Correct. I think of a patient that she was scared that she would find out that she had breast cancer. She had some symptoms that were worrisome, and she came in for another injury into the ER, and luckily one of our ER providers just said, "Hey, why don't you establish care with a family doctor? They can give you a once over and top to bottom exam and look for things." And unfortunately, this patient of mine was really far down the road with a cancer diagnosis, with breast cancer, to the point that any intervention, chemotherapy, radiation, surgery, she was too far down that road. And so there is a lot of fear around the word cancer. I notice when I talk to patients and talk to them not only with a diagnosis of cancer or screening for cancer, a lot of people just don't want to know. And but these are very treatable things nowadays. As you said, we have an infusion center on the second floor in our hospital, and people do chemotherapy and other infusion interventions, and people can have quality of life, and they can come here to a small hospital in the middle of nowhere, and at the end of the day, after their treatment, go home and feed and be with their families. And so there is a huge paradigm shift, as you discussed, that we need to really educate these patients, especially ranch and farm families. They spend so much time caring for what they have, and it's really hard to focus on themselves. And so there is quite a bit of misunderstanding of how medicine has changed over the last few years.
Carmen, I'm curious, as you said, you're teaching students at Ani Nakota as well as at MSU Northern. A lot of these colleges are colleges that probably have students that are going to be going back to rural areas by and large, or at least a percentage of them are going to be going back to rural areas. Do you discuss these sorts of challenges as you're doing that education piece? I'm thinking that this is probably something that'd be more relatable to these colleges than maybe somebody that's going to MSU in Bozeman.
Yeah, definitely. A lot of the students end up serving along the High Line and in rural. Some of them go, further away, but a lot of them end up back in our area. So, which is one of the reasons I really like at Ani Nakota. It's called Grow Our Own, and that's like the goal of the community, is like they want to grow nurses. So definitely there is. We do talk a lot about like our patients' like culture, and I really think that ranchers and farmers and ag related people are a cultural subset that are different than other cultures. So we talk about that, and for sure, and try to, talk about how we can build relationships and establish rapport with our patients.
Carmen, you've been at this now for a little while. You're a touch younger than I am, but you're ticking along. But have you seen any change in response to medical care, just in the general population of the rural folks that you work around as you've gone through your career? Or do you still see the reluctance, I don't want to know if something's wrong, or I'll go in next year, kick the can type of a mentality?
Yeah, I do think that, as you kind of mentioned, generational differences too. I do think that people our age see like the advantage more of getting things caught early. And whether that's just because of medical advances, or if it's because we've seen the effects of waiting too long in older members of our families, maybe that's part of it too. I don't know. But I think that millennials have, maybe that's a good thing that we have, is that we do see some of that, like what we can save ourselves later by paying it forward now kind of thing. Like if we take care of ourselves and if we, do our screenings, there is, advantages in the long run to that.
I just had an aha moment as we were having that discussion about the insurance component, because if we're going to go very traditional, which folks that know me know that this is not where I love to go. I don't love to define that the rancher is the man and the wife works in town. But if we're going to go very traditional, going back to my parents' generation, and I'm sure yours, Carmen's as well, the husband did work on the ranch, and the wife did have some supplemental income, but it was not enough income or enough hours that it would have warranted health insurance. And so there probably was a major health insurance hurdle for that demographic too, that now you and I, are able to oftentimes in our generation have available health insurance through our employer that we can spill over into family. And then that does take some of that worry off of everyone's shoulders.
A lot of insurances now too, even if it's high deductible, require preventative screenings to be covered. So even if you have a high deductible and you're not going to meet your deductible for the year, your insurance is still going to cover annual labs or annual screenings, which is really great, honestly, that's like that.
Absolutely. And Dr. Ross, are you seeing that kind of transition as well, that people don't worry about insurance quite as much as maybe they once did?
Yeah, historically, I just look at my friends and family members that worked in agriculture back in the old days, and insurance was just that extra thing, and people would rather pay into the ranch or buy more cows or buy more hay to feed in the winter instead of paying for insurance. There are so many other programs out there nowadays that we can work really well with insurance companies. We have a financial planner at the hospital. Her whole job is to help families obtain insurance and so that they can get the care they need. But I agree with Carmen that the majority of these preventative screenings for cancer and other diseases are covered, and that's one of the great things that happened with the Affordable Care Act years ago is only about 30% of insurances covered preventative care prior to the Affordable Care Act. And so there's a lot of not great things about the Care Act, but that's one of the great benefits that we've seen. We've actually seen a great rise in the younger ranching families coming into care because they don't have to worry about the insurance. They don't have to worry about all the what ifs, what if I can't pay my bills, and, can I afford to come to town? And so, yeah, I have definitely seen that whole pendulum swing the other direction, where a lot of times now these younger families have no problems bringing their kids or their other family members in for care.
And I think so often too, the medical expense, it's like going to a mechanic. It's just a different type of mechanic. And you don't know what that bill is going to be. Sometimes you open it up and it's like, oh, that was $70. And then sometimes you open it up and it's like, oh, that was $1,470. And it's just this game of what insurance covers what. And, it's uncomfortable, I guess, for folks. And so I understand where there's sometimes that little bit of a reluctance to just dive in. And then because when you open those bills, it can be a little bit spooky sometimes, for sure. I also wanted to talk about this touch point of having a professional in the room to talk about the mental health screening portions of this. We had, as Rancher Stewardship Alliance, last year or the year previous, Jolene Brown come and speak. Jolene Brown is a phenomenal international speaker. She does succession planning, talks a lot about the emotional sides of succession planning and kind of getting through some of those tough conversations with families. We've had her on a previous podcast. You can look back and I'll link it in the show notes. She's really famous for saying that life isn't fair. You don't have to split the ranch evenly. That's not what necessarily keeps the ranch surviving. But one of the things, this was actually previously when Jolene Brown was in Glasgow at an event with the Glasgow Chamber. She was talking about a mental health aspect to succession planning. And her advice, I thought, it resonated more with the audience as far as mental health advice than a lot of advice that I've seen. And it was the discussion that in rural clinics, very often you walk in, 6 people in the lobby. You check in, the gal at the reception desk, the person that's taking your blood pressure, you go through all of this scope of people that you know. it's already hard enough to talk about your mental health and the fact that you want to go to a doctor because you're feeling down or you're having suicidal thoughts or just something's not quite right. The stigma to that makes it a hard discussion to have. But then when you think about having to go to the clinic and having to have that discussion with gatekeepers along the way can sometimes be enough of a deterrent that you just never go in. And her advice to that group was, nobody needs to know your business until you have your doctor in front of you. So you can say up until that very, very last person that you've got a sore throat. And they may have things lined out a little bit wrong for your appointment and kind of be thinking they're doing different tests than they're going to do. But nobody's going to be mad when you're sitting on that thing and they've got their strep swab ready or whatever it might be. If you say, actually, my throat's just fine. It's just me. I'm not feeling good. And you can have that discussion. So that, of course, is, an appointment for mental health. But even in the most general appointment, you're going to have a baseline mental health screening. And so, Dr. Ross, I think as I can talk about my dad on this podcast because I guarantee he doesn't listen to it. I can't put him on Facebook. He gets really mad because he knows when he shows up there, but he doesn't listen to this podcast. But I can guarantee when he went into his first couple of appointments and he was getting these mental health questions, he was like, what is this person ask? What are these questions about? He really, not having that background of going through that questionnaire, he had no idea what those questions were about. So for folks, Dr. Ross, that maybe have not ever been exposed to that, kind of tell us what that screening is all about, what you can expect when you walk into the clinic with that.
Well, thank you. That's one of my passions is making sure that people are healthy physically, but also mentally, emotionally, and even spiritually. And so 12 years of age and older, as you come to the clinic, and part of your intake when the nurses take your vitals, we're going to ask you questions and make sure that you're safe from a mental health standpoint, but also that you're thriving with mental health. And so there's a series of 10 to 12 questions that you'll be asked. For example, are you having more sad days than good days? Have you ever felt worthless? Do you have anxiety or panic attacks? Have you ever been suicidal? There's a lot of these screening questions that we can do. If those do pop positive, those are very good indicators of need for intervention. And so it's important to remember that mental health disorders, a quarter of the U.S. population identifies as having some degree of depression or anxiety. And so that's a huge number. And so the stigma of mental health needs to go away. If you are a diabetic and needed insulin, you would take the insulin. If you have depression and anxiety and you needed a medicine or a counseling appointment, there should be the same amount of acceptance for that. And so that's something that I feel like our clinic does very well at mental health screening. And we review those screenings every time we go into a patient room. And those questions, if they pop positive, then we know what direction to go. And so we also, at our clinic, are lucky to have a PhD psychologist and a licensed social worker that do counseling as well. The way our clinic is set up is as you check in, it's very private, and people in the waiting room don't always know if you're coming in, like you said, with a sore throat or with suicidal ideation. You check in, the door closes behind you as you go in to the clinic, and you see the person you need to see. And so hopefully that helps take away some of that stigma and makes it a better experience for patients. But I think the biggest part of the stigma is not knowing what we don't know. And I look at my parents and their generation. My parents are in their 80s, and back then, depression and anxiety was a weakness, and there was something wrong with you. Now we know it's a medical diagnosis. It's miswiring of hormones in the brain, just as diabetes is miswiring of your pancreas. And so that we are working very hard every day to kind of take that stigma away, but also give patients their privacy as they check in.
What I love about that test too is because the questions are so uniform, it's really easy to, graphically see your peaks and valleys throughout the years if you're going in on an annual basis. And, there's apps that you can do it on your phone. You can access those same exact questions online. If somebody doesn't want to do them through through a clinic, but you want to as what I'm feeling depression, you can go online and you can take that exact same questionnaire as what you're talking about, Dr. Ross. And it's just a great way to sort of baseline and be like, oh, okay, this is what this is. The not having an appetite or eating too much or not sleeping or sleeping all the time. It's a wide gamut of questions, but it's about a life response, not necessarily about I'm feeling sad. It's about the symptomatic parts that you feel that you might not recognize if you didn't know what that was. So, and yes, also just not being afraid to go on the medication. I've gone off and on antidepressants and anxiety meds for the last 5 years, and they're wonderful to help you through when you need them. And for me, I've been able to go on and off. Some people are on them, but gosh, it just feels so much better to actually have that assistance. So no shame to anybody ever for that. All right. So we are almost out of time. And Carmen, you always have such colorful anecdotes. I just want to sort of open the mic to you on this conversation. When I said, I want you to come and talk about rural healthcare, I want you to talk about twisting people's arms, making them go in, what came to your brain? What were you thinking about this conversation?
Oh man, I thought to myself though, I'm like, I have a lot of funnier goat stories so much than healthcare stories, but anyway, I did, bully all my, both my brothers and my sister-in-law and my husband. This spring there was a Rocky Mountain biometrics screening here in Malta that the Highline Heritage Foundation had set up for a fundraiser. So like if they got enough people to come in and get their lab screening, they would donate money. We're trying to raise money to build a new pool in Malta. So that was one of my things that came to mind. I said, everyone's doing this and this is where you can schedule your appointment. And that was a really great opportunity in our community to get your labs done. If you hadn't had them done with your insurance, it didn't cost anything. And then they, in return, it was helping the pool too. So that was something I did recently. But I just, I hope that people listening to this just know that like getting those things done and taking care of themselves is really important. That's an important part of continuing the ranching legacy and the farming legacy is taking care of yourself.
That is a sneaky, sneaky collaboration, and I like it. Taylor Holman and Kyla Burns with FMDH had a lot of assistance with the pool funding for Glasgow's pool that just got built. So I'll have to put that under their hats for the next fundraiser they get involved in. Forced screening, and then we can do some fundraising associated with it. Dr. Ross, do you have any final thoughts on this grand scheme of things and how we actually get folks to come in before we get to a stage where something is just comfort care? How do we get to preventative care and not comfort care?
I often think back to my days of cowboying and ranching, and we deliver calves, we run them to the warming shed and start their life early and check them out, and then there's times throughout the life of an animal where we background, we vaccinate, we do all those things to prevent illnesses. We try and keep people in that same kind of pattern. I've worked in big feedlots, before I went to medical school, and there was always a sick pen, and you were chasing your tail trying to doctor these steers and trying to get them better before they die. And I think of the sick pen scenario with us as humans, that it's better to vaccinate and do all those things than ignore those things early and then end up in the sick pen, or like you said, in comfort care, at the end of somebody's life, there's so many preventable diseases and so many things that if we have early detection, we can treat them relatively painlessly and with ease. And my greatest desire and why I do rural health is I want to break that stigma of not going to the doctor. Screen early, look for those things that we can prevent. I've seen ranchers come in, I had one rancher come in, he broke his back and he was in extreme pain, but he finished feeding before he came in. Ranchers are tough, and I've worked with them, in my former pre-medical life, and I understand that, if you're out in the middle of nowhere and you cut yourself, that electric tape will sometimes work, but definitive care, and especially preventative care, is the way to do it. Screen early so that we don't have to have those hard conversations and make extreme quick medical decisions down the road.
I would say also just a message to, we talked a lot about cancer screening and preventative, but just to encourage, farmers and ranchers, sometimes they get injured and then they ignore it too. And that can be pretty devastating down the road. So it's okay to go to the doctor, even if like a bone isn't sticking out, even if you got an injury that you're like not sure of. And if they do x-rays and it wasn't, and you don't need more care, that's great too. But don't feel bad if you go in and it wasn't something more serious. It's okay just to go in and make sure.
Dr. Ross, my question for you is, what tangible advice do you have for folks as far as the bare minimum of medical attention, preventative care, screenings, yada, yada, that they should do? Knowing that these folks are probably reluctant to come in at all, is it an annual screening? Is it a screening every other year? Is it dependent upon age? What, if they're going to do one thing and do it well, what is that one assignment you're going to give them?
The one thing that I would recommend is annual screenings. That's straight from the American Medical Association, and the Academy of Family Practice, which I belong to, recommends annual screenings. We've seen that decreases mortality or dying from illnesses. Cholesterol screening is 1 to 5 years. Breast cancer screening is, I recommend annual or biannual mammograms. Cervical cancer screening, and pap smears is from ages 21 to 65. And so getting those basic things done, colon cancer screening, cholesterol screening, things that can lead to heart attacks, strokes, and to terrible diagnoses of cancer. At least do that once a year. If you want to toughen out a cold at home until you can't toughen it out anymore, that's okay. From my standpoint, as long as we're preventing future illnesses and injuries down the road.
I also mentioned the mental health screenings, but I forgot to mention that when I was going through my OB appointments for when I was pregnant with Mr. Wilder, but I had brought various friends with me to my appointments so that I could have somebody with and join in on the excitement. And rural hospital, most of the folks that were checking us into the rooms, they knew exactly who these friends were and the like. But we had one gal who did not know who I was and did not realize that this friend that was with me was not my spouse, was not my partner. And so I had to do the screening for the family member assault, the Are You Safe in Your Home screening, whatever that's called. But she did it so discreetly so that I could answer it as to if my friend Lindsay couldn't see the answers, just in case Lindsay was my partner and was abusing me at home. It was done so discreetly and so politely, but just cracked me up all the same because Lindsay was just there to make sure I had enough food in the freezer once the baby came in to join in on my excitement. So it was just kind of a humorous thing, but just another screening that when do people have that opportunity to ask and answer those questions in a completely anonymous and safe environment, and so important for people that are in those situations. So, all right, Dr. Ross, you've already summed up, I know, some beautiful points. Carmen, I know you had some last thoughts that you wanted to give us as well.
Yes. So I wanted to excuse me. I just wanted to say to farmers and ranchers, my neighbors, my friends, my family, you care for the well-being and health of your animals. You care deeply for the well-being and health of the land. You care immensely for the well-being and health of your communities. You deserve all the attention, all the care that you give so freely to those around you. You are the greatest resource, the greatest asset in agriculture. You are worth it. Your physical and mental health and well-being are so important. It's worth the effort, the time, the money it takes to take care of yourself. Your children, your families, your communities need you to make your health a priority.
As we wrap up this episode of the Ranch Stewards Podcast, I just want to leave you with this thought. Every operation runs on its people, the land, the livestock, the legacy. None of it continues if we don't take care of ourselves first. Preventative care isn't a chore. It's not another appointment to dread or another thing to check off a list. It is ranch insurance, plain and simple. It's how we make sure the work we love, the families we care for, and the communities that we're part of can keep thriving. Again, a heartfelt thank you to Dr. Kevin Ross with FMDH, and to Carmen Salveson for sharing her story and her heart and always her perspective. And thank you to the listener for making that appointment. If you haven't already done so, please go ahead, make that call, do the screening, and take care of yourself.
You've been listening to the Ranch Stewards Podcast, a project of the Rancher Stewardship Alliance. If you like what you heard, head to ranchstewards.org for added content, or follow the Rancher Stewardship Alliance on Facebook and Instagram.